think listening to some of the teachers that we've heard from over the sort of last 2 days at the forum, I think often the solution to some of this is actually just to ban. If we put in some technical filtering and so on, we'll stop children from coming up against the inappropriate or the harmful material that they might encounter. And I think prevention is often seen as something that's quite easy to do, but actually intervention is probably what we should be doing, but it seems to be much more difficult.
Well, in terms of filters, they can be quite, they can have some outcome in the younger ages, but an adolescent really can, put the filter out and then get in and say, I wasn't there or something, because they can do anything.
They can get around it.
Yeah. So it's a matter of really communication and limits, and this balance between emotional support of parents and limits. Because if you don't have emotional support, limits cannot be accepted by the adolescent because they are not convinced that it's for their protection. On the other hand, if there are no limits and all the emotional support, they really become, sort of spoiled. So back to your question about prevention. The main thing is that we really focus on prevention because it is very well known from, like ancient years, that preventing a situation is much more cost benefit but also social benefit than intervening, because intervention can be really hard. From our experience in kids and adolescents that have addictive behaviors or been bullied, they have been so much traumatized that you really need a lot of effort and long-term intervention to put them back to a balanced situation. But in terms of prevention, you can really offer a lot of things to a lot of children, and this is what we must focus on. And prevention has to do with information and public health design, and a lot of domains that can collaborate, like the state of each country and the school, the parents, the media, and also like we do medical or other professions that can put input and work all together. So prevention should really be our focus, and for kids that already have a problem, of course, intervention. But parents have to be informed. They don't, as you said, they do not know about these dangers, and they think that if they leave their youth alone and unattended in a room, they are protected. So
because they're in the house.
Yeah.
So you mentioned parents there. I mean, which parents should we be targeting? Because we know that they're a difficult group to engage with sometimes. And we've got parents of preschool children, of teenagers. Is there one particular group that you think we really should focus on?
As we said earlier, every group has different needs and developmental needs. And as internet starts after, before the 3 years, actually, we must not really put kids on screen. But after 3 years, they start playing and they like interacting. So parents should really, as we said, learn from a young age how to have communication channels open, and also give emotional support along with limits, and have this really precious balance. In adolescence, parents need a lot of support anyway, because adolescents are a difficult group, and if there's no basis from earlier age, it can be really hard. So I would think it's parents in general, and parents that can be really very much active, can be the models for other parents and start communicating and educating other parents, like peer-to-peer education in children. They can help there too. It really needs a good design, but prevention is really the thing we must focus on through parents and teaching.
That's brilliant. Thank you very much.
Thank you.